I'm Deanne Carpenter with the Mary Lanning Diabetes Program, and November is Diabetes Month. Our program has been around since 1997. We've been certified by the American Diabetes, and over the last 25 plus years, we have worked with a lot of different people with diabetes and developed our own ideas and tips and stuff that I'd like to share with you today. So first of all, diabetes is very manageable. There's not a one-size-fits-all. There's a lot of different places that people are in their journey with diabetes. Some people are newly diagnosed. Some people have diabetes for 50, 60 years. So everybody's at a different spot. But the one thing is it's very, very manageable. There are over 50 medicines available nowadays for diabetes, between insulins, different types of insulin, oral medicines, injectable medicines, lots and lots of things to help with blood sugar monitoring from the continuous monitors, and a lot of great technology out there for insulin pumps that anybody would want to do something like that. So it's very, very manageable with everything that comes around that's available for diabetes. When it comes to diabetes management, we always think about nutrition, exercise, and medicine. And so we'd like to give you a few tips on each one of them. First of all, exercise. Whatever you can do to exercise is to your benefit. Whether it's just getting up and walking around at work, whether it's parking farther away at the parking lot, any kind of exercising you can do is to your benefit. What exercise actually does is it opens up your muscle cells, and it allows the insulin that you are making or taking from the outside to do a better job of moving your sugar from the blood into the cells so you can utilize it for energy. So there's nothing bad that we can say about exercise. It's one of the best things that you can do for diabetes management and weight control. Another tip would be nutrition and making sure that you're eating a healthy diet. We do like foods that are more whole grain and less processed. Make sure you're getting a wider range of fruits and vegetables and that your plate is nice and colorful. And of course, portion sizes are important when it comes to diabetes management. Another portion of it is insulin and medication. So like I said, there's over 50 different things approved for diabetes when it comes to medication. And if you are somebody that's taking insulin therapy, you definitely could get a continuous glucose monitor. So we have found that continuous glucose monitors do make a big difference because they do check blood sugars every 1 minute, if not every 5 minutes. And they send that information to like a handheld receiver or a phone. So you can constantly be looking at your blood sugars. And all the research shows is that people that do wear continuous glucose monitors usually get better blood sugar control, better A1Cs. And from our diabetes program, we have definitely found that that's the case. And then the last tip that we would want to do is if you haven't seen a diabetes educator, we would refer you to a diabetes educator. So it's really important that people get education and have a better understanding about what diabetes is. They just understand it better. They know how nutrition, exercise, and medication works. And so we definitely would refer you to a diabetes educator. If you would like to see somebody here at Mary Lanning, you can give us a call or talk to your physician. Our phone is 402-461-5318. Thanks.